Hi, Dr. Carly Causey here with Dr. Mike Ross at Seattle Sports Chiropractic. Today we're going to go over sciatic nerve flossing. So a little caveat before we start here, if you're having numbness, tingling, weakness, that sort of thing, and you're not a patient of ours, it could be something a little more serious, so be sure to get in and get it checked out. If you are a patient of ours, however, and we've given you this exercise, this can be great to alleviate some symptoms down the leg. It can also be great to alleviate kind of chronically tight hamstrings. So sometimes people with chronically tight hamstrings haven't had the sciatic nerve addressed, and it can be an issue that the nerve isn't sliding and gliding through the muscle properly. So to start, let's talk a little bit about the nerve. We're going to think about the nerve for our intents and purposes here as a piece of cooked spaghetti, okay? So we're trying to take the nerve, we're trying to slack it at one end and pull it at the other, and then slack it at that end and pull it the other way. So we're never trying to pull on both ends of the nerve. You can imagine that doesn't sound like it would feel very good, okay? So really important that you take these steps piece by piece and get them all right, and slow down the exercise a little bit if you need, okay? So to start, we're going to have, for step one, we're going to have Dr. Ross extend his low back. So for a lot of people to get this low back extension, we really need to move the head. So we have his head supported by a pillow so he keeps his spine nice and neutral. He's got a little low back extension now. That's step one. Step two, we're going to go joint by joint down the leg. So he's first going to bring his hip up all the way to where he can get the knee all the way straight. He's got to get this knee all the way straightened out. Go ahead. And then he's going to pull the toes, oh yeah, up to the nose. Good. Now he's going to reverse that, point the toes, bend the knee. Good. Bring the hip back down. And now he's going to do a little crunch here, bending forward. Good. And that's one rep, okay? So you'll notice, go ahead and go back to kind of neutral. You'll notice that he's never in a fully flexed position. So let's show him what they don't want to do. He never wants to come into this position. Yeah, okay, good. Come on out of that. Because that's really cranking on the nerve on both ends, okay? All right, let's go through one rep again. So go ahead, have him extend all the way back. Lumbar extension, good. You'll notice his hip is nice and neutral while he does that. Now he's gonna go ahead, bring the hip up. Good, just to where you can get the knee straight, straighten the knee, good. Then pull the toes to the nose, good. Point the toes, bend the knee, hips come back down, good, all the way to neutral. Then he does his little bit of a crunch. Good, and that would be one full rep. Great, go ahead and back to neutral. Give it a try, let us know what you think. Don't forget to like the video and subscribe to our page. Dr. Carly, Seattle Sports Chiropractic.